Before you begin, you want to survey the scene and things that can make the scene unsafe. If you're outside of a building, that could be traffic, it could be an active stabber, active shooter incident. If the scene is not safe, you will not approach. You will go ahead and call 911 from a safe distance. However, in our instance, we're surveying the scene and everything is safe. Now we need to check for responsiveness. So we're gonna go to the victim's shoulder and we're gonna say, hey, are you okay? Are you okay? We're gonna tap and we're gonna shout. We're just not going to shout because the person could be deaf. And I really wanna try to stimulate this person because I don't wanna be compressing on their chest if they don't need it. So I'm tapping and I'm shouting and the person is non-responsive. At this point, if you're in the hospital, you can go ahead and press the code button. If you're outside of a hospital system, you're gonna go ahead and call 911. 911 is gonna be asking you, what's the emergency? You have a person who's not responsive. That doesn't mean that they're dead. If someone's blood sugar is low, if they've overdosed on drugs, they will be non-responsive, but you'd still see chest rise and fall. Or if you're a healthcare professional, you'd still be able to feel a pulse. And so in our instance for CPR, we're feeling for the pulse with our index and our middle finger we're feeling on the carotid artery on the side nearest us, and we're watching for chest rise and fall. If you're old school, yes, you're putting your ear to their face, but I promise you, that's not really necessary right now. All right, so 2 fingers, carotid pulse, looking for chest rise and fall, 10 seconds max. That's right, you get 10 seconds to decide whether or not you need to render aid. There's a breath that's called an agonal breath. It's more like a gasp. If there are no signs of life and the person lets out air, you are to assume that this person's in cardiac arrest because an agonal breath is a precursor to cardiac arrest. And so now one's on the phone, I'm telling them that there's no breathing, there's no pulse. They're gonna ask, do I have an AED? And in our case, we have our trainer here, so yes, we have an AED. We're gonna start high quality CPR, and it now begins with chest compressions. Whenever you think of ABC, airway, breathing, circulation, you wanna focus on the airway as long as the person still have a pulse. But once your victim is pulseless, our job is to focus on high quality chest compressions. We need to circulate that oxygenated blood to the brain. Whenever someone's heart stops, the oxygen doesn't leave their system. It's still there, it's just not moving. They have residual oxygen. So your goal is to start those chest compressions quickly. The new priority is CAB, circulation, airway, and then breathing. If you think about 10 years ago, the American Heart Association came out with guidelines which said that you can just do hands-only CPR, which means that you wouldn't have to put your mouth on the victim's mouth. Whenever the advanced professionals arrive, they're usually going to come with equipment and then they can take over the breaths. But for our purposes today, I do have a pocket mask with a one-way valve, and we're going to use this to simulate our breaths. So here we go. As far as our chest compressions are concerned, whenever you're compressing on the chest, what I like to say is don't compress on the throat and don't press on the very end of the breastbone. That's the xiphoid process. Pretend the victim has a perfect nipple line and you're going to place the heel of your hand in the center of their chest. Yes, the chest should be exposed. And men, if you feel uncomfortable exposing a woman's chest, the Good Samaritan law is going to protect you if you are rendering aid. If you still feel uncomfortable and you have 911 on the phone, you've called for help, we want you to start those chest compressions on top of clothing. But if you do realize and you're really trying to save this person's life, the reason why we expose the chest is in preparation for the AED. And so we do want you to do something. And there is a healthy fear of, maybe lawsuit or litigation because you exposed a woman's chest. But that fear, I hope to negate that today and to decrease it, because we need for you to save a woman's life the same way you save a man's life. Hand placement center of the chest. You would then take your shoulders, and your shoulders should be aligned with your hands. You're going to press straight down. Lock your elbows. When you compress deeply enough, which is 2 inches, for our mannequins, you're going to hear a click. A human, you're going to feel resistance, and that resistance is a rib. And unfortunately, or the breastbone, we may have to sacrifice this breastbone right now in order to get to the heart. That's the body's natural protective mechanism. We have the rib cage and the sternum there for a reason. However, if I'm trying to save someone's life and trying to compress on their heart in order to circulate blood, I may have to go ahead and press deeply. And depend on the size of the person. Okay, we said 2 inches, but if the side view of that person's chest is larger because they're obese, you have to bring that chest in a third of the way. So depending on the size of the person, the more you may have to compress. But then we have an average size person here, we're going to compress 2 inches. 4, 5, 6, 7. We're going to do 30 compressions. After 30 compressions, we're then going to utilize our pocket mask, which is more like a teardrop shaped. The angle of the mask goes over the victim's nose. We're going to press, and then we're going to open up the airway with a head tilt chin lift technique. So let's repeat that. Pocket mask, angle portion, bridge of the nose, press, tilt, and now you're going to give a breath. Repeat it and follow it by a second breath. So after 30 compressions, you give 2 breaths. Each breath should last about 1 second. What you don't want to do is hyperinflate the chest by giving too much air, because if you give a really big breath, you can actually inflate their stomach, and of course the victim would vomit, and we don't want that happening. So now I'm going to repeat this process, 30 compressions followed by 2 breaths, and now I'll continue doing this until help arrives, until I'm exhausted, or until the AED arrives to the scene. So let's do a couple of cycles first, and then we'll utilize our AED. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 'Whenever you're compressing, it's really important that you allow for chest recoil. And what chest recoil does is whenever you compress down, you circulate blood. When you allow the chest to rise to its normal position, you allow the heart time to fill back up with blood. So if you're pressing really fast, you're not allowing full chest expansion. So press down, let it raise, and you're going to continue doing this until the scene becomes unsafe, until the victims have signs of life. If they do have signs of life, you can turn them over into the recovery position. If help never comes and you're exhausted, you can stop your efforts. You know, you can only do so much by yourself. And then of course, you've called for help. So when those advanced providers come and they're in position and they take over, that will be another reason when you can stop your CPR efforts. And now we have our AED. The AED stands for Automated External Defibrillator. The reason why we say external is because some patients will have their implanted defibrillators or their pacemakers. And you'll know that because you'll see like an elevated area beneath their skin. At this point, if someone's in cardiac arrest, don't overthink it. Yes, you can use the AED if somebody has an implanted device. You just cannot place the pads on top of that implanted device. If that device was doing what it was supposed to be doing, it would be shocking the person in cardiac arrest if the person required a shock. And so the first thing you do when the AED arrives to the scene is you're going to power it on. Once you've powered it on, you want to follow the prompts. They're really user-friendly. And if you work in an environment that has an AED, my request to you is I always give people homework, is I want you to take a picture of the AED. Find the name, find the brand, and then go research that on YouTube, because I need for you to know how to work your company's AED in the event of an emergency. And a lot of people say, well, we have employee health or we have the nurse. And my question is, what happens if it's the nurse who's in cardiac arrest? So I need for you to be a responsible adult and go ahead and use the AED that's at your workplace. Learn how to work it, not just the nurse or the healthcare professionals. We're going to power this on in a few moments. After we power it on, it's going to tell me to apply the pads. And the pads have an image. It has a diagram on it, which shows you the pad placement. And with an exposed chest, it is high right, low left, okay? And so when we say low left, when I talk about the stomach, we're talking about where that crease of the breast would be, because that's where the strongest part of the heart is. After we apply the pads, pill and stick, it is going to tell us to connect it. You have to learn how to use your AED because some models operate differently. Once we connect it, it is going to say, analyzing heart rhythm, do not touch the victim. And I want you to make sure that no one's touching. You're going to make sure that everybody's clear. I am not preparing you to work as part of a multi-rescuer team. I want you to use this AED exactly as it states. So once we clear it, it analyzes, it's going to let you know whether or not a shock is required. And if a shock is required, there's going to be a light that flashes. When that light flashes, you press it, just make sure no one's touching first, and then you go right back into your compressions because there is not a residual charge, any energy that's left over that can harm you. All right, so we talked about it, let's actually perform it. All right, so what's the first thing I do when the AED arrives to the scene? If you said power it on, you're correct. Second thing I do,
apply pads,
is listen.
Patient's bare chest. Plug in pads connector next to flashing light.
If you don't know how to place the pads, follow the instructions that are on the actual pads.
Apply pads, plug in connector.
Make sure the chest is exposed and clear. Once my pads are placed, it's flashing to let me know where to connect it at.
Apply pads, plug in connector. Analyzing heart rhythm.
No one can touch when it's analyzing. Make
Do
sure
not
everyone's
touch
clear.
the patient.
Everybody's clear?
Shock advised.
It will flash when it's time for me to
Charging.
press the button.
Stay clear of patient.
No one touch. Everybody remain clear.
Deliver shock now. Press the orange button now.
The button that's flashing is what I'm going to press.
Shock delivered.
And we go right back into our chest
Begin
compressions.
CPR.
The tone that you hear, that beeping, is called a metronome. It helps you keep the pace of your compressions. So if you go too fast, slow it down and go with that metronome. The metronome ensures that you're allowing for chest recoil and that you're compressing between 100 up to 120 compressions per minute. And if you still have your pocket mask or one-way valve, after your 30 compressions, you go back and give your 2 breaths. For classroom purposes only, I am turning off this AED because I don't want to talk over it. It's a little bit distracting. In the real world, you would keep your AED on until that person reaches their final destination. So let's say that you're in the daycare center and you have to use the AED. You keep that AED on until the paramedics place theirs on. The paramedics are going to keep their AED on until the person gets to the hospital. Even if the person is talking to you, they've regained a pulse, do not take the AED pads off and don't turn the AED off because these pads are usually single use. And if the person loses a pulse again or if they stop breathing again, another shock may be required. So we want you to prepare and stay ready. And of course, if the person does regain consciousness, don't leave them on their back because they could vomit. Once you've stopped your CPR efforts because the person has achieved a pulse or they're breathing, you want to put them on their side in a recovery position with the AED still monitoring them. And the AED is going to reanalyze every 2 minutes. And if the person does require another shock, you would lay them back down, follow the prompts, and when the prompts have completed, you've pressed the shock button, you go back into your chest compressions. All right, everybody, so that was a quick review for CPR and AED for an adult. And children is not much different. A child is from age 1 to puberty. And so if you have a large 10-year-old, if a 10-year-old is an adult size, I need you to treat him or her as an adult. So let's say we actually have a child who has not yet reached puberty. You're still compressing 2 inches or 1/3 the side view of their chest. It is still 30 compressions followed by 2 breaths. The difference would be the reason that a child goes into cardiac arrest. More than likely, it's not their heart being an abnormal rhythm. It's because something's in their airway, okay? Maybe they drowned or maybe they have an object in their throat. So breaths are really important. And you actually do want to look in their mouth before you give the breath because if you can see an object, you can do a finger sweep. You can also use 1 or 2 hands with a child. If it's a really small child, and you are okay with compressing with your one hand and you're sure that you're getting down 2 inches, do the one-handed technique. However, I don't have enough upper body strength with just one hand, and I want to make sure that I'm giving this child the best chance at survival. So I'm still going to use 2 hands when I'm performing CPR on a child victim. Your pad placement is also the same. They do have pediatric AED pads. However, if you only have the adult pads, use the adult pads and follow the images. The only difference will be is if you have a really small child, which I'll show you with our infant demonstration, is you cannot allow these pads to touch. And of course, if the child is smaller, the pads are going to be closer together. If that's the case, you put one pad on the center front of the chest and one pad in the back. When in doubt, who's on the phone with you? That is right, 911. You have the dispatcher. They're going to work with you and they're going to make sure that they are helping you to help save this person's life. All right, everybody, this is Eunice Mathis with Florida Training Academy. And if you just stay tuned for one moment, we're going to go ahead and show you how to save an infant's life. Hello, everybody, welcome back. We now have our infant station set up. And same as with the adults and with the children, we're going to make sure our scene is safe. So we're going to look left and look right, make sure that there's nothing that's going to injure us. If there is an unsafe scene, if you can pick the baby up and take them with you, by all means do so. But your job is to make sure that you are safe also. And now that we have an infant here, the way that I check for responsiveness is I actually tap on their foot, which is their more sensitive area. So I'm going to tap on this baby's foot. There is no response. I'm going to go ahead and call 911 from my cell phone. If there is a person nearby who can help me, I can point to them and say, hey, you call 911 and come back. And 911 is going to say, what's the emergency? You're going to say, hey, there is a baby who's not responsive, and they're going to ask, are they breathing? Do they have a pulse? And so you can look for chest rise and fall on the baby. You can also, in the baby's inner aspect of their arm, if you take your index and your middle finger, you can feel for the brachial pulse. We don't feel for a carotid pulse or neck pulse in infants because they usually have larger heads and little necks, so it's going to be harder to determine if they have a carotid pulse. But here, brachial pulse, there is no breathing, there is no pulse. You can then, if you haven't called for the AED, go ahead and call for the AED also. If you have the Preston mannequins, they have a feedback device and you just want to activate it by turning the little blue button on, you're going to press it, that's on their diaper area. You can do infant compression one of 2 ways. You can use your 2 fingers, or if you find that hard because maybe you have arthritis, you can do the 2 thumb encircling hand technique. And I'll show you both techniques right now. The hand placement, we're going to go in the center of the sternum, the lower half, but not on their stomach. I'm going to do 30 compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. For an infant, you'd be compressing 1.5 inches or still 1/3 the side view of the chest, allowing for full chest recoil, and you would still be performing at least 100 up to 120 compressions per minute. If you have your pocket mask in your one-way valve, if you remember from the previous video, that the angled portion goes towards the bridge of the baby's nose. We're going to do our head tilt chin lift, and we're going to give a breath. All right, I gave my 2 breaths, and now for my other technique that is also allowable, I'm going to go ahead and do the 2 thumb encircling hand technique. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. When I administer those 2 breaths, press, tilt, and I would continue doing this until help arrives. And my help just arrived with the AED. If you recall from the previous video, we're going to power it on.
Apply pads to patient's bare chest.
We're
Plug
going
in
to
pads
listen to the
connector
prompts.
next to flashing light.
We have the smaller pediatric pads, but if we try to place them according to the pad images,
Apply pads. Plug in connector.
the pads are going to touch, and that is not allowable. So we're going to place one pad
Apply pads. Plug in connector.
to the center front of the baby's chest. And the second pad,
Apply
center back.
pads. Insert connector firmly.
I'm now going to insert the connector.
Analyzing heart rhythm.
Make sure no one is touching the
Do
baby.
not touch the patient.
Everyone stand clear.
Shock advised. Charging. Stay clear of patient.
Everyone remain clear, don't touch.
Deliver shock now. Press the orange button now.
I'm going to press the button that's flashing. Make sure you don't touch the infant while you're pressing this button.
Shock delivered.
I go right back into my chest
Begin
compressions.
CPR.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. And you would continue 30 compressions followed by 2 breaths until more help arrives, until you're exhausted. If the scene becomes unsafe, and again, you can take the baby with you, please do so. And if you're in the hospital, then of course you have your rapid response team, or those advanced professionals who can take over. For classroom purposes only, I'm turning off this AED because I don't want to talk over it. But again, in the real world, you would keep this AED on, and it's going to reanalyze every 2 minutes, and you would do that until the baby actually reaches final destination. And so again, if you're in a child care center, that could actually be whenever the paramedics arrive and they place their AED on. If you have any further questions, my name is Eunice Mathis. I would love to be your instructor. I'm here in Jacksonville, Florida. Our website is FLsInFloridaTraining.com. You can leave a comment down below. So everybody, that's our quick review. I do appreciate you. I thank you for watching. I thank you for being a lifesaver. I'd rather you know these skills and never have to use them versus needing to use them and never refreshing, never reviewing these skills. If you want to know how to help a choking victim, just watch the next video. All right, everybody, have a great day.